Healthcare workers in America, you need to wake up and take responsibility. We as physicians and other healthcare workers need to step up and be the change. We need to be a good example in regards to lifestyle so we can help annihilate these chronic diseases that are plaguing America. And yes, indeed, our healthcare system certainly is failing America. So many good, hardworking American people are suffering from these chronic diseases that don't even need to exist. 36% of adults now are obese, and the rates of diabetes are just climbing and climbing and climbing. The trends are absolutely alarming. The rates of diabetes will increase by 54% to 55 million Americans by the year 2030. And diabetes is one of the main risk factors for heart disease, which remains America's #1 killer. Despite the fact that heart disease is preventable, at least 80% according to the World Health Organization, and perhaps even more according to other authorities. Research clearly shows that heart disease is predominantly preventable through lifestyle changes, through healthy diet, through exercise, through not smoking and maintaining a healthy weight, and some research even shows that heart disease may be reversible. Let's see how we're actually doing in America. Patients with heart disease have their blood sugars controlled only 52% of the time, their cholesterol only 30% of the time, only 70-80% of them are non-smokers, only 49% of them have adequate blood pressure control, only 18% have a normal body mass index, and only 22% of Americans with heart disease are following the exercise guidelines. How are we doing with diet? Only 1% of Americans with heart disease are following the proper diet according to the Healthy Eating Index, which is more based on USDA dietary guidelines, and we know a more strict approach, eating more whole food plant-based, is even better according to the ACC/AHA guidelines. This means Americans are doing absolutely dismal with diet. Well, at least physicians know better, right, and eat a healthy diet? Nope, according to this publication by Dr. Kim Williams in the International Journal of Disease Prevention and Reversal, Kim Williams was the past American College of Cardiology president. More than 70% of physicians have an unrestricted, unhealthy diet. Unhealthy food in the diet of physicians and healthcare workers today is no different than how it used to be in the 1950s and 60s when all doctors smoked. They used to smoke in the hospitals. Doctors used to promote cigarettes, despite the fact that powerful science was emerging that cigarettes were horrible for your health. Nowadays, doctors and healthcare workers attend medical conferences where processed foods and processed meats, sugary, salty food is served all the time. I remember during my cardiology fellowship, our journal club served us nothing but soda to drink, pizza to eat, and potato chips on the side. Well, that's not what I was served at the International Conference on Nutrition and Medicine that I attended recently in Washington, D.C. I had the pleasure of speaking about lifestyle medicine and heart disease, and what they served us here, the food was absolutely amazing. Whole food, plant-based, low fat, low salt, low sugar, unprocessed. You have to check this out. This is how we should be eating as healthcare workers to annihilate chronic diseases and be the change that we need. Check out my video on lifestyle medicine and heart disease, which is a condensed version of what I presented at the International Conference on Nutrition and Medicine. Now remember that the 2019 ACC/AHA guidelines for the primary prevention of cardiovascular disease recommend a plant-based diet for prevention. And this is in alignment with other statements from the ACC advocating a whole food, plant-based diet for the prevention of heart disease. How are we supposed to expect our patients to take their medications for hypertension, diabetes, high cholesterol, and other diseases that are in these same guidelines if we as physicians don't even follow prevention guidelines ourselves to keep ourselves healthy? Not only how can we expect them to take their medications, but how can we expect our patients to follow a healthy diet if we're not doing it ourselves? Whether you call it a DASH diet, a pro-vegetarian Mediterranean style diet, or a plant-based diet, we as physicians and healthcare workers need to be the change and be a good example. I always say that there are three food categories. We have processed foods, we have animal-based foods, and we have whole, unprocessed, plant-based foods. No matter how you do it, you need to remove those processed foods from your diet, dramatically reduce or eliminate those animal-based foods and focus on eating whole, unprocessed, plant-based foods, and then you're going to be healthy and follow those guidelines and be the example that we need you to be. You can check out some of my other videos to help guide you as to how to do a plant-based diet the right way and how to lose weight the right way. We need to be following the American Heart Association recommendations for exercise, getting at least 30 minutes a day of moderate intensity aerobic exercise 5 days out of the week. Add some resistance training. No matter what you think, physicians are looked up to as leaders in the healthcare industry in the United States. Yet the number one cause of death amongst physicians remains heart disease. We need to flip the pyramid in our current healthcare system. On the left is what we now have, where preventative and public health care is a very small portion and primary care is still too small. We focus most of our resources on secondary and tertiary care when people are already sick. We need to flip that around and make it so preventative and public health is the main part of our pyramid, and then we grow primary care and teach them lifestyle medicine so we don't need as much secondary care and as much tertiary care. A paradigm shift is needed away from pills and over to a lifestyle medicine approach, away from the pharmacy with a PH to the pharmacy with an F. Our current acute care model with only short appointments, seeing only the doctor and getting paid for productivity, not being paid for prevention, is not adequate. Lifestyle cannot be discussed in that framework. In our new system, we need a long appointments. We need an integrative approach. We need to get paid for keeping our patients healthy and not paid for just seeing more patients and doing more procedures. Lifestyle needs to be the main focus. And I get it, it's not that straightforward. America is so sick and there's so many different reasons why. Our culture is unhealthy, our food system feeds us unhealthy food, our government policies don't subsidize the right things, but our healthcare system needs to shift towards prevention and we need to lead that change. Physician burnout is a big deal. Well, I have a potential solution for you. Check out the American College of Lifestyle Medicine. Whatever your specialty is, you can be rejuvenated by focusing more on lifestyle. The 6 pillars of lifestyle medicine: nutrition, physical activity, restorative sleep, social connection, avoiding risky substances, and stress management can help your own health and then help transition your practice to focus more on lifestyle medicine. Even if you don't shift specialties within your specialty, focusing on lifestyle medicine can be rejuvenating and give you a new meaning to your practice. Check out some awesome programs like Walk with a Doc, follow a plant-based diet, and spread the word. Be the change we need you to be. Thank you for listening. We as healthcare workers can indeed change our system and save so many lives in the process. First, by focusing on your own health, taking a lifestyle approach, eating plant-based, exercising, maintaining a healthy weight, then find a way to integrate that into your practice. I'll have a bunch of resources of how you could do that in the description below. Don't forget to like this video and subscribe to my channel. Leave a comment below, and let's change healthcare in America away from a sick care system to a true healthcare system.